Okay, so let me touch on the dates for the points mass distribution, then we get there. So the points mass distribution is beginning today.
Yeah.
That is the registration. You're starting registration today up to Sunday. That is 9th to 13th April. Right after that, in a month time, which is 2nd to 6th May, we are going to begin the distribution. So if you don't get registered, you are not getting the net, because the net will be allocated per the number of people registered.
Right.
Okay.
That is the flyer on the screen.
Yes.
It says the Ghana Health Service Ayawaso West Municipal Health Directorate Point Mass Distribution 2025 for long-lasting insecticide net. It's actually LLIN. Okay. Registration date, as Yvonne mentioned, Wednesday to Sunday, 9th to 13th of April. The distribution dates also Friday to Tuesday. That is this Friday. So after the registration, then the distribution.
No, that is on 2nd.
Oh, 2nd May, right?
Yes.
2nd to 6th May, right,
Yeah.
right. But why do we have to register to get nets? We'll talk about that. Trained registration assistants will move from house to house to register all households. Okay, I think it's not making sense. Household heads should provide their name, national ID, contact. For getting a mosquito net, we have to go through all these.
Yes. So just like everything the government does, everything organizations do, there has to be accountability. And then we have to know the number of people who took the net and see how effective it is. So these are the data that we use in decision making and policy making, and even allocation of funds, So this is why you need to register. And then we want to be sure, even this is more of like a census as well, because you are registering households.
But it will also depend on the area you're covering. Is it the entire Accra, and is it happening across the country?
So
just the
so
Ayawaso
currently
West?
it is happening in Greater Accra region, and then Ayawaso West is one of the districts it's happening in. So in our area here, we'll have trained registration assistants who will go and then register everybody in your homes. So we don't register people in shops and all that, because some of them do not live there. So anybody we meet in the home, once the person is able to provide a number of people in their home, then we are good to go.
The necessary documentations or requirements to get registered. They are
and
good
the
to go.
World Health Organization's recommendation is that at least 2 people to a net.
2 people to a net.
At
so what
least.
if we don't sleep together?
So if you don't sleep together, and then you stay in the same room or different rooms.
We say in different. So if 2 people to a net, for instance, you get into a household which is not a family house but a compound house, and there are about 8 people in that house, that means you have to provide 8 nets, because everybody has their Why not?
Okay, so
that won't be fair that
8 people and everybody has...
Yes, everybody has their separate rooms.
But
so
it's a
separate
compound house, it's not a
yeah.
family.
No, they are not a family.
Yeah, for that is understandable.
Okay, but if it's a family, 2 people are entitled to 1.
To 1. Unless it's an elderly person over 75 years.
Okay.
For such a person, we allocate a net to the person.
Okay.
So let's take a polygamous home, for instance. Like our Muslim brothers and sisters, or some of our people. A man with, let's say, 3 wives. The wives also have their kids. So if I should enter such a house or a home, as a registration official, what I'm supposed to do is to find out how many people are in the house. Then we will now ask the man that we want to distribute the net, and it is 2 to 1. Okay, but then because you have many wives, which of your wives would you like us to pair you with? So we pair the man with one of the wives.
Then the
other
other 2 wives
are
will be
two. No,
Okay, so two, okay.
Yeah,
okay.
with their kids.
Okay.
So two, then everybody gets sorted out. But aside this, if you're not able to get it through the point mass distribution, there are pharmacies that actually sell some. We also, like I said, the primary schools.
The point mass distribution.
It's free.
It's free.
Yes.
Okay.
It's free.
Okay.
So you actually see people with the shirts I'm wearing here. Yes. They will come to your homes and then register you. It may not necessarily be green, but you should expect something like this written on it. Good. So, if you're not able to get it during this avenues, the pregnant women, we give them during their first visit to antenatal. We also give children 18 months. Okay. So when your child is 1.5 years, we give the mother, and then also the class 3, class 2, school children.
Right.
So we are trying to cover it as well, and this has brought like tremendous change in Ayawaso West right now. We've been at pre-elimination in 2024. It means that malaria cases, test positivity rates have reduced.
Wow.
Good. So we are looking forward to eradicating. Let me say eliminate, because eradicate is to eliminate malaria in our district. So this is one of the initial. Aside test and treat and all the others, this is what we want to do now.
Right. That's very impressive. So then, if I do not come into contact with the mass distribution or I'm unable to register, you can walk into any pharmacy shop, you said. Can't we get it in the hospital, like as individuals, not necessarily pregnant or children?
For the hospitals, for most things you will have to buy them, and we don't have them available in the hospitals now to give to individuals who work in. So please take advantage of this program and then get yourself registered and get some for future use even.
And I'm interested in the fact that your focus is on pregnant women and also infants, because the theme for this year's World Health Day has to do with healthy beginnings for a better future. And yesterday I read a story of the UN and a finding that they made about the fact that infants and mothers are dying needlessly, and the causes are very preventable. And I want to believe that these are one of the interventions you health workers or healthcare providers are putting in place to bring maternal mortality and infant-related mortality to a minimum extent. Right. So I mean, is this part of that broad intervention that the world is working at, including the Ghana Health Service?
Yes. So this, like you already said, is part of the interventions. Aside safe use of medication with the pharmaceutical. The Pharmacy Association is also dealing with in this year for this particular World Health celebration. We are also looking at what we can do in our individual fields, and in public health, this is one of our initiatives. And then even making sure babies are safe, helping babies breathe. There are lots of initiatives, but this is one. Once the baby is protected in utero, because if a mother should have severe malaria, the mother can miscarry the child. She may lose the child or both her life and then that of the child. So this is a very, very laudable step we are taking, a very, very bold step we are taking, and we want to remind you that please make sure you sleep under
a treated net. Please make sure the net is not hot. It's your room that is hot. It's not the net. It's your room. So the recommendation is that if you're feeling hot under the net, you might probably want to ensure some more ventilation or put in some additional alternative ways to feel cooler. But it's been very exciting talking to you, because exciting in terms of seeing the efforts put in place to help us live a healthier life and forge into a healthier future. But what would be that one thing that you want to tell Ghanaians when it comes to malaria and eliminating it, as you said?
Okay, so in relation to the insecticide treated nets, I'd like to tell Ghanaians that this is the most cost effective method. You can't complain, you can't say that I'm not able to afford it, because even if you are sleeping on the streets or you are sleeping in a car somewhere, this net can be set up and then you can protect it. We are trying to interrupt the pathway of transmission. That is getting the infected mosquito, preventing the infected mosquito from biting you at the first place. So please, we are celebrating World Health Day. Listen to us for once. Thank you.
Listen to us for once. Yvonne is trying to say we don't listen. So for once, she is urging us to listen. But I'm just thinking to myself that the net is, I mean, it's a viable option. And also cleanliness, keeping your environments clean so that there are no, mosquitoes, what do you call, breeding around and all that. However, are there not advanced ways to also, because people feel these measures, not everybody adheres to it, as we know. So advanced measures like perhaps creams that we can use, medications that we can take to protect our immune system and all that. Are there stuff like that?
Yes, there are actually other interventions, like we are saying. Aside the medication, which is the treatment, we also have even malaria prophylaxis for pregnant women. We also have the mosquito repellent creams. I think Medisoft has something like that. So mosquito repellent creams. We have the sprays and all of that.
Can we use it alternatively?
Yes.
In place of the nets?
Yes. Once you are able to follow for the repellents, for instance, once you apply it, you make sure that all other parts of your body that do not have the repellent, you apply a generous amount, is covered, and you don't stay out too late. You clean your environment. In other parts of the world, there are mosquitoes, they don't even have the parasite to be transmitted at the first place. So keeping our surroundings clean is also one of them. So let's just alternate and then use what suits you.
Just be conscious of the fact that you need to protect yourself, because malaria is actually real and it kills people, and people do not know that. But let's wrap it up with the advice of people testing for malaria before treating. It's an issue, and it's an issue. People just feel headache, feel like, oh, me malaria, this is how I'm feeling bitterness in my mouth. It could even be something else, but we say it's malaria. So please speak to that.
Okay, so when it comes to malaria, every fever is not malaria, because every disease, most diseases, most infections start with a fever, especially when they are systemic infections. So do not mistake any kind of fever as malaria. Please make sure you test before you treat. Our pharmacy attendants, please and please help us out. Make sure you test your clients or test your patients before you treat them. And please take your health as your own responsibility. Ensure that you are tested before you go in for treatment. Please, can I hit on the our program a little bit?
Yes, fine. Let's wrap it up.
So with our program, again, we are starting our registration today all the way to Sunday. Make sure you are registered. When we come to your house and you are not home, we write on the wall R or RX or RL. They all mean different things. RX means that there's been some household in that very place that have refused to be registered. Then with a circle around it means that we have registered every household. And then RR means that everybody in the household, in that compound, has refused the net. So we are to revisit the place. Okay. So if you see any of these signs, do not be alarmed. Please let us write on your wall just for this week. Allow us to write on your wall just for this week.
It's giving me some ideas, but we are not going to go there. But yes, Yvonne, thank you so much, and wish you the very best. And to everybody who is going to be approached to be registered, please comply, because this is for the greater good. Thank you, Yvonne, and I'll see you next week.
Yeah, thank you.
Next week, see you. But to you, I just want to remind you